With apathy, you don't have those things. You just don't have any motivation. You're just content to sit. Okay? Happens a lot of times in folks who've had strokes, but it's basically because you've knocked out the part of the brain, believe it or not, there is a part of the brain that gives us motivation, that gets the rest of us out of bed in the morning and into work, or at least some of us. It gets us out of bed on the weekends, and so that we have something to do, some kind of hobby or something. There's a part of the brain that controls that, and in Alzheimer's disease and sometimes in strokes and other neurologic illnesses, you can have that part of the brain be damaged, and the person just is content just to sit there. So they're not sad, they're not hopeless and ready to die or anything like that. They just don't care. They don't care. So that's for a lot of people, that's a change. That's not the normal personality, and so the family members are concerned about that with good reason. So apathy is something to keep in mind. Now, Alzheimer's disease, I said, was the most common type of dementia. Now, how common is it? It obviously gets worse with age. So the higher, like if you're 60 to 64, there's about a 1% chance that a person, there's about 1% of people that are age 60 to 64 that have Alzheimer's disease, okay? But when you get over 85, it's 30 to 50%. It's a lot of people, okay? 4 to 5 million people in the country, in the U.S. have Alzheimer's or have dementia of some type. That's a lot of people. It's a lot of, and it's going to get worse because as the population ages. So scientists obviously are working pretty hard on trying to figure out something to stop this illness, or even to cure it. But stopping it would be a nice thing to do first if we can do that. About 60 to 80% of people in nursing homes have dementia, and I think that probably doesn't come to a surprise for folks that work in nursing homes or have been visiting other folks in nursing homes. So it's pretty common. Again, of the types of dementia, Alzheimer's disease, like I said, is the most common. It's about 65%. And then the second most common is this one, is vascular disease. There's a little bit of controversy about this. What this is basically where somebody has damage to the brain that's caused by strokes. Now, remember I said that dementia, by definition, it has to be at lots of different places of the brain that are damaged, right? Because if it's just memory, that could be one focal pathway in the brain, but it's not. It's a bunch of other things too, personality and all the other things we talked about. So you'd have to have a lot of different strokes all over the place to cause that. And that is probably a little rare. So even though they say this is the second most common, and it's about 20 to 25% of dementias, we're starting to realize now that really these two go together pretty commonly. So a lot of folks that have Alzheimer's have some vascular disease in their brain. When you scan their brain, they've got some damage in there. Maybe not full strokes, maybe not big enough strokes that the person ever knew, by the typical symptoms, inability to speak or weakness on one side or whatever. But there's just little teeny tiny spots where it looks like there's been damage in the brain. Very common, you see that in Alzheimer's disease. By the same token, a lot of vascular dementia patients probably have some of the same thing that's causing the Alzheimer's disease going on in their brain as well. And the other thing that tells us that might be the case is that the treatments for this also work for this. So probably there's a similar thing going on underneath, okay? Now, you got to ask yourself, what causes this? What happens that would cause Alzheimer's disease? Obviously, you probably think, well, we don't know what causes it. We don't. You're right. We know some. We know that there's probably an inflammation in the brain, some type of inflammatory process in the brain that starts to kill off nerve cells, the brain cells, okay? It's not a good thing to lose brain cells. As we age, all of us are losing brain cells as time goes on. As we age, probably from about the age of 25 or 30 on, you start losing more than you're gaining. The more there's certain things you can do to kind of slow that process down, to keep your brain strong. Part of it is using your brain and such. Also dietary things, you watch it when you eat, exercising, things like that. But you start to lose them. Now with Alzheimer's disease, you lose them faster than you should though. And then you start to see symptoms, start to see problems with that, related to that, the symptoms that we just talked about. What happens is that at least for the memory part and the concentration part of Alzheimer's disease, there's a type of nerve cell in your brain. Remember we talked before about there are chemicals that your nerve cells use to talk back and forth to each other, okay? We've talked about serotonin, I think, one time, and dopamine one time, okay? And this is another one called acetylcholine. Okay? That chemical is used again for memory. All right? So if you're losing the nerve cells that make it, then it's not able to, that's why you're having trouble with memory. Okay? And we'll get the reason I'm telling you that, not so you have to remember that, but just because there's medicines that work on this. And I'll tell you how they work on it in a few minutes. So this is the challenge, I guess, for the scientists to figure out why do you have the inflammation in the brain? What causes that? And they're starting to figure out that it may have something to do with some of the same stuff that causes damage around the heart. Where you can clog up your arteries and you start to get damage from that. But it's years earlier that folks start to see changes in the brain. And there are these little plaques and tangles, they call them. I kind of think of it like weeds in a garden. You ever had a garden? I'm sure folks have had gardens before. If you have a lot of weeds in your garden, what happens to the good plants? They start to get choked out a little bit, right? The nutrients and the water and everything else gets sucked up by the weed, and then it chokes out the good plant. And the good plant in this case is a nerve cell. Okay? So the nerve cell dies off, and you make some new nerve cells, but that you can't keep up. And basically, the problem is we don't know what's causing these weeds to grow, but they are growing years before. Sometimes 20, 30 years, you can see evidence in a person's brain of these things starting to come on. So imagine if you could figure out how to use preen in the brain. You know what preen is? Anybody use preen? I know Christine uses preen. But if you could use something to prevent the weeds from growing, then you might be able to prevent this illness. So they're working on all kinds of things, like vaccines to these things. If they could use a vaccine that would prevent this plaque and tangle from growing in the brain, that might prevent the illness. So that's really what we know about what's causing Alzheimer's disease. The other types of disease, as you can imagine, vascular dementia is caused by the strokes, like I talked about. The most common cause of a stroke is where you block one of the blood vessels in the brain. And of course, the brain needs blood, it needs oxygen, and that's how it gets it, through the blood. If you block the blood supply to the brain, no different than the heart, you kill off part of the brain, just like you kill off part of the heart. That's called a heart attack. Some people talk about strokes, and they call them brain attacks. I don't know if you ever heard that before, but it's a similar kind of thing. So that's the most common reason that these folks lose brain tissue, is because they have some type of stroke. Now, the other types of dementia, Parkinson's disease, Michael J. Fox has this. You guys are familiar with that probably, but it causes a lot of motor problems, and that's because part of the brain's dying that controls the motor function of the body. And if it dies off, and then if you start to have spread of damage to other parts of the brain, you can also get dementia with that. Now, when it comes to the other types of dementia, for right now, there's Lewy body dementia, frontotemporal dementia, things like that, but I'm not going to go into too much of that because of the difficulty trying to get all that covered in 1 hour. Something that I think you should all be aware of is that if you know somebody or have a family member that has Alzheimer's disease and they don't have enough of this chemical in the brain, which we talked about, there are some things that can dramatically worsen them that you got to be really kind of careful about. And stuff that I don't think a lot of people know about. But anything that would block this chemical, as you can imagine, you don't have enough to start with, then you block it, that's not a good thing. What do you see? Well, you see what looks like Alzheimer's disease getting way worse really quickly. It's called delirium, okay? Right, here's the word. The delirium is and how do you tell the difference and why do you care? Well, you care because it's associated with a pretty significant mortality. So a lot of folks will die if they get this. And it's usually caused by some kind of medical emergency or medical illness. So bladder infection or a new medication that was recently added, or even something more serious, pneumonia or some other type of thing like that. And what happens is the person gets the illness, gets sick like that, and or head injury can even do it too. You see sometimes people get a car accident and you'll be kind of confused and dazed and out of it and they're delirious. It's because basically all those things basically block this chemical down. Well, so I just told you that Alzheimer's disease patients don't have enough of that. So they're at risk for this big time, right? They don't have much room to squirm or to move. Or they're already starting to have some short-term memory loss and some problems like that. Now all of a sudden they get a bladder infection, drops down this, for some reason it drops this chemical in the brain, and they get delirious.